Hello. Welcome to Emmi.
All right, this short program is about what it's like as a patient when your doctor's part of an accountable care organization, or ACO. All right, I'm here to tell you about a new way doctors and other healthcare providers are working together to give the best care to patients like you. It's called an ACO, and it stands for Accountable Care Organization. Or you might even hear terms like accountable care networks, neighborhoods, or even comprehensive continuum of care. Sounds kind of dry, right? So what does it really mean? Well, it's when doctors and other healthcare providers form a team who are all focused on improving the quality of your care and your experience as a patient. But it's important to know it's not about limiting what doctors you can see. You can still see all of your current providers. It doesn't affect your insurance or change your benefits. And it does not cost you more. In fact, a lot of patients see doctors who are part of an ACO and don't notice many changes at all. But one big change is more coordination and communication among any providers you see. Seems like that's how it should be now, right? But as you probably know, that's not always how it works. Let's say your doctor finds out your cholesterol is high and thinks it needs to be treated. You'd probably have questions. What are your options? What does it mean for your health now and down the line? But without an ACO, too often doctors only have a few minutes to talk before they have to move on to the next patient. So you might get a prescription, but not answers to all of your questions. And you only have enough time to talk about problems going on right now, not how to stay healthy and prevent future problems. Now, let's say you're having a problem with your knee, and your doctor suggests you see a specialist for more help. But she may not have your records, or she may not have time to look them over before your appointment. So you end up spending valuable time filling her in on your whole health history, what medications you take, what tests you've had, and what's happening with you now. But how are you supposed to remember everything or even know what's important to tell her? And once again, before you know it, she has to see the next patient. Also, what if something happens when your doctor's office is closed and you can't get a hold of him? You may end up in the ER, where the doctors don't know you, your history, what you take, or what's going on with you. Again, it's up to you to fill them in. You may end up getting tests or treatments you've already had, plus a lot of stress and wasted time. When you get home, you've got to make sure your doctors know what happened and what tests and treatments were done. Plus, the whole focus is on treating problems after they happen, instead of stopping them before they start. It can feel like you're running in circles, and important information is slipping through the cracks. Because no one's really looking at the big picture. Enough already, right? But here's the good news. When your doctor's part of an ACO, it's different. Your providers work as a team led by your primary care doctor. Your primary care doctor is kind of like your home base for all your health needs, so you might hear it called a medical home. But it's not a place. It's actually a way to give you more personal care. Your primary care team gets to know you well and make sure you're getting the care you need. They stay in contact with all of your providers and share information, often with secure electronic medical records, to make sure everyone is up to date before you see them. That means you shouldn't end up with repeated tests or prescriptions. And you don't have to spend time at every appointment bringing your provider up to speed. You can get straight to what you need to know. When your providers work together and share information, they can treat you as a whole person and help make plans to keep you healthy, instead of only treating problems one by one as they come up. Your team is made up of whoever you need, like specialists, nurses, therapists, dietitians, and other health educators. But whether your team is big or small, it includes healthcare experts, like care coordinators, navigators, or advocates. Your care coordinator is sort of like your personal guide through the healthcare system, and they can help make sure you get the right care at the right time at a place that works for you. And if you do go to the ER or the hospital, your team will work with the doctors there to make sure they have complete and up-to-date information about your health, so you're not overwhelmed when you're not feeling your best. Plus, your team will be filled in about your treatment there, and they'll work together to figure out next steps, so you can focus on getting better. But this kind of care isn't just about helping when you get sick. It's about preventing problems so you stay healthy and out of the hospital. So your team also makes sure you get the right screening tests. They make time to talk about healthy choices, help you come up with your own goals, and make a plan for how to meet them. And it's not just about what care you need, but also how you need it, whether you need to sit down with your doctor or you just need some information by phone or email. Maybe you'd like a group visit to talk about what's worked for other people in similar situations, or time with a health educator or dietitian to make sure you understand what's going on with your health, what you can do to take better control, and make a plan that fits your life. Of course, every ACO is different, and they may offer different things, but they all work with their patients to figure out the best ways to improve their health. I don't have to tell you healthcare can be complicated, and it can feel like doctors just have pieces of information about your health. But when you've got a team caring for you, they can bring all the pieces together and see the whole story. So everyone can focus on giving you the right care, the right way, at the right time, the way it should be.
I hope you found this information useful. Thanks for watching. I wish you the best of health.